Our first witness tonight is a wonderful friend, a long-term worker in dealing with homelessness, graduate of the Baptist Theological Seminary in Richmond, also a graduate of VCU University with a PhD in social work, professor of social work at UNC Charlotte, and now I believe the director of the Urban Institute at UNC Charlotte, Dr. Lori Thomas. Dr. Thomas.
Thank you, Rodney. And thank you, everyone. I'm very pleased to be here. I'm very honored to be a part of this process. I have been working in homelessness since I was in my MSW and PhD program, and in affordable housing before that. So I have spent over 20 years in this work, and I wish I could say it was getting better. We've gotten smarter in some ways, and in some ways we've not tackled the systemic things that we need to tackle to ensure that we don't have tent cities. So to understand the current crisis, which it's important to know it's not new to the pandemic, we must understand our history, and our current crisis points us there. I think particularly important to note is our current crisis is not new. The virus-fueled tent cities that we are seeing now only shows that COVID exacerbated vulnerability and brokenness, but the vulnerability and brokenness was already there. And we see that in a couple of key statistics in the years leading up to the pandemic. In 2018, we were already seeing the well-worn patterns that would define the impact of the virus. So approximately 51% of our rental units here in Mecklenburg County were low cost in 2010. We're defining low cost as under $800. By 2018, only 25% of our rental units in Mecklenburg County were low cost. And we see conversely that the rates of rental units that are $800 or higher have increased in the opposite direction. As was mentioned on the previous slide deck, the minimum wage we currently have is insufficient to pay for housing. You have to work 113 hours a week, 16 hours a day at minimum wage to afford a fair market rent to afford a 2-bedroom apartment. Or you'd have to find rent in this city at $377 a month. Or you could make $17.96 an hour to afford a 1-bedroom, or $20.44 an hour for a 40-hour work week to afford a 2-bedroom apartment at fair market rent. There is not one county in this country where housing is affordable at earning minimum wage. Not one county. And so we see cost burden. Those renters who are cost burdened are increasing. Over 90% of households that earn less than $35,000 a year are cost burdened, meaning they pay more than 30% of their income on rent. 45% of those cost burdened households are severely cost burdened, meaning they pay more than 50% of their income in rent. And we know that severe cost burden is concentrated in lower incomes. Lower incomes are disproportionately represented by Black and brown people. We know that 10.9 million households in the US are severely cost burdened. And that leads us to what looks like a relatively small number, but it's an important one when we're talking about these larger national and local numbers. You saw another number, that the number of people who've been actively homeless through July, which is over 3,000. This is a key way that we count homelessness, though, is we take a snapshot of it at one point in January. It's how funding is based in the United States. It's a requirement to get funding. And it really is a census on one night in January, the colder time of the year when we think we can get more people and understand more people. It's also the time when we really understand who is homeless among us, and the groups that they belong to. How many are women? How many are men? And in this case, as I'll talk about a little bit, how many folks who are experiencing homelessness are Black. We also know that this is a severe undercount. What this means is it is only folks who are unsheltered and those who are in emergency shelter or transitional housing on that night. It does not include folks who are in a hotel. It does not include folks who are staying with family and friends. So we know that this number is an undercount, but it gives us a place every year to come back and to understand the makeup of our homeless population, as well as trends related to that one night. And what we know, that persons homeless in Mecklenburg County are disproportionately Black. 79% of the folks who were counted on one night in January of 2020 were Black. That's compared to 31% of our overall population and 42% of our population in poverty. This isn't particularly surprising. It's designed this way, a design feature. But it's important to understand this in the context of the rest of what I will talk about, particularly in terms of COVID. We're starting to see literature and research now synthesized to show us why Black and Brown and Native people are experiencing the worst outcomes of this virus. And one of the key ways is we know that they are disproportionately exposed to COVID in their work situations. Compare 51% compared to 41% of white workers. We also know that because of that, Black and Latinx people experience higher rates of COVID-related infections, hospitalizations, and deaths. And so, how did we get to this place? How did we get to the place of disproportionality? How did we get to the place of a problem that has not gone away? How did we get to the place of the exacerbation and the vulnerabilities exploited by the virus? So we have competing explanations of homelessness since the 1970s and 80s, and you can guess that early on, many of our explanations focused on individuals. What was going on with individuals that made them fall into homelessness? More recently in our history, we started to focus on structural explanations. For example, that homelessness is a reflection of a housing market. We should start thinking about the historical causes of homelessness in terms of two related questions. One is, how did the problem get so big? And two is, who is more likely to experience it? So I'm going to walk through those for a couple more minutes, and then I'll close and for the rest of the evening's conversation. Both answers, the answers to both of these questions point to a system designed, consciously and less so, to get the results that we see. And so let's dig into that a little. So the extent question, how did the problem of homelessness get so big? Primarily, the problem of homelessness grew because of housing policy, social safety net policies, and the systemic racism that undergirded these policy efforts. So let's dig a little here, and I'm sure I'm not suggesting anything that is new to people, but it's helpful to focus in on it. So housing policy in particular, designed from the beginning to inadequately or differentially serve particularly Black communities, but also Latinx communities and other communities of color. Federal home ownership programs, rental housing assistance were segregated from the beginning. Investment in people and place justified by race-based relative risks led to flourishing white suburbs and Black urban cores with limited access to capital for housing or infrastructure. Since the roots of redlining were never addressed, well-meaning and not so well-meaning efforts that paralleled and followed, like public housing, like housing choice vouchers, like urban renewal, often reinforce patterns of segregation and continue to benefit some communities and deprive others. And market solutions. Housing has always been influenced by the market in this country, but today the primary way the federal government supports affordable housing is through low-income tax credit program and housing choice vouchers. Both of these are dependent on market rationality in some way or another. And so we find it hard to assemble deals to pay for housing for those in the lowest incomes. We also find source of income discrimination where it's difficult for folks to get housing, get landlords to accept housing. And we know that all of our policy solutions have been chronically underfunded since the 1970s. So the other piece, our diminished safety net. Our diminished safety net has also led to the problem of homelessness being the size that it is. So at the time when we were seeing housing programs go to block grants, we were also seeing entitlement programs that provided people a path out of poverty. We were starting to see those entitlement programs diminished. I put this picture up on purpose because I think it's really important for us to understand at the beginning of another Democratic administration of the harm that can be done in both Republican and Democratic administrations. We have fewer ways for folks to get a foothold in the market now because we don't have programs to support folks. Those programs were problematic from the beginning, no doubt. But states are now able to choose how to direct funding, and they're often directed to more palatable services that do not serve our poorest people. And typically those poorest people are our poorest Black and brown people. Programs like adoption programs, marriage supports were many of the programs that funding from entitlement programs went into at states' choices instead of the programs that supported the most poor. We see increased eligibility requirements that make it harder for folks to get supports. We see shorter time limits. The combination of this limited housing support and fewer paths out of poverty combined to increase visible homelessness in the 80s and have replenished its ranks ever since. And so that's the size piece. Not enough housing, not enough paths out within our safety net. But there's also this distribution piece. Who is more likely to experience homelessness? And if we're going back to that kind of individual structural explanation of why we have homelessness, let's dig in one more time to the structural piece. I'm going to come back and end with the individual piece because I think this is the place we're all too comfortable going. But our structural factors, criminal justice policies. If you come out with a felony, you're automatically going to struggle to find housing, rental housing, particularly if you're Black, and we know people are disproportionately Black coming out of the criminal justice system. And we see the disparate policies around, for example, cocaine and powder and crack cocaine impacted communities differently and led a direct path into homelessness in many cases. The impact of war, and we know how war differentially impacts Black and brown people. The impact of deinstitutionalization, and this is often considered the cause of the size of homelessness, but little literature points to that. But it is a risk factor for folks who have mental illness and cannot find appropriate services after services in the community were not appropriately funded. And then of course, labor policies that do not provide a living wage, that do not provide other supports like health insurance and other things that end up bankrupting people. So we see these structural factors that suggest that people are much more likely to become homeless because of them. There are others that we could mention. What I'd like to do is end on individual factors, because there is literature, some you could argue that's bad, some that you could argue is good, well done, some that's poorly done, that points to the correlation between lack of education, workforce skills, substance use, health and mental health issues, trauma, networks with limited resources. But I want to add a caveat to this, because I think this is where our comfort level, both in this community and nationally, happens when we talk about homelessness, is we want to assume that people who experience homelessness are a population apart. And they're a population apart that needs extensive supports in order to be housing ready. And instead of looking at housing as a right, this concept of housing readiness suggests that people aren't born housing ready, but they need to get an education. They need to develop appropriate workforce skills that are appropriate to a predominantly white workforce. They need to, well, that's a complete interesting way to think about the substance use issue, since we know that many people use and abuse substances, and depending on your wealth and depending on your race, depends on your outcomes related to that. But we expect that people accomplish something in each of these places in order to be ready for housing. And housing as a right, it undercuts that and suggests that people are born housing ready. And another thing in closing that I would like to say is, if you haven't read this book, I would highly recommend that you do it. It's called Race for Profit, Keeanga-Yamahtta Taylor. It's an incredible book, and she walks readers through this short-lived program at the beginning of HUD history that she describes as predatory inclusion, when the markets that had been closed to redlining suddenly opened as a new profit center for those in the real estate field. And in doing so, in a predatory fashion, offered loans for home ownership to primarily poor Black women in the urban core. And when the program failed, because the program failed when you put folks in a home that does not have appropriate plumbing, that for years of redlining had been not taken care of, no capital available to take care of it. Instead of recognizing an early program failure at HUD, the program designers and I would almost say the royal we here turned it back around and said, those people just don't know how to take care of a home. This isn't about program. This isn't about structure. This is about these people. And probably my back goes up more than anything else when I hear people describe homelessness and homeless people as a population apart, and as an individual issue more than the structural and racialized issue that we know it to be today. So I will stop there.
Thank you so very much, Dr. Thomas. It's always wonderful to hear you. I learn from you every time you speak. And your presentation tonight has really given us a lot to think about. I had a bunch of questions I'd like to ask, but in the interest of time and because of the fact that you so thoroughly covered everything I wanted to raise with you, I'm going to move on to our next guest this evening. But one thing I will say is that I really appreciate the fact that you've tied this together. This is not an isolated issue. It has to do with living wages. It has to do with access to jobs. It has to do with a whole lot of other factors that are tied together. So we need to deal with all of these if we truly are to transform what's going on in Charlotte. Thank you so much.